Hello everyone, this is Dr. Krupan Kumar, General Physician working at TX Hospitals, Kachiguda. Today I just want to tell you some points regarding coronavirus and complications associated and what are the vaccines which we have seen in the market and how they are working and complications associated with vaccines. These are the few topics just want to highlight. So what is coronavirus? It is a virus which is born at Wuhan 2019, which this virus has created a big change, dramatic change in the whole world and change of lifestyle of every person in this world. So coronavirus is most dangerous virus ever a human has been affected. So regarding coronavirus, I just want to give you some highlights. So coronavirus is a virus which is seen first time in China, Wuhan city. This virus has a typical molecular structure and it gets attached to the tissues in the lung and creates the complications. So right now I just want to highlight some of the clinical symptoms of coronavirus. The male clinical symptoms of coronavirus include fever, which will be around mild to moderate and moderate to severe also in some cases. So fever will be around 99 to 100 degrees and in some patients we see more than 1 or 2 also. So fever is the first clinical symptom. Along with that, headache and nasal discharge, cough, throat pain. So these are the symptoms. And in some patients, we also notice abdominal discomfort, abdominal pain, loose stools, and nausea, vomiting, giddiness. So these are the clinical symptoms we see mostly in corona cases. Once in these conditions, patient coming with fever, headache, throat pain, nasal discharge, and cough, mainly cough, which is dry, irritant cough, we mostly suspect towards coronavirus. So this coronavirus is easily transferable to human. Mainly, it is easily transferred to air, transferred through. It is a transferable virus. So most of the world is affected, mainly due to transfer. This virus is transferred from airborne. So it is almost like airborne, we can say. It is transferred from one patient to one patient. When the patient affected with coronavirus has a cough, cold, or when he has a fever and any symptoms of as mentioned above. So this kind of patient should be isolated at first. Isolation means he should be isolated in his room and not to be in contact with any person, because he should not be a person to transfer the virus from him to other persons. So mainly isolation is the main theme we see in these cases. So one, fever. Then fever, as I've told you, it's moderate to mild to severe also. In some patients feel difficulty in breathing also. So this difficulty in breathing is due to the effect of coronavirus on the lungs. So this virus mainly attacks on the lungs of the diseased. It occupies the area in the lungs where there is a exchange of carbon dioxide and oxygen. It halts on the place where there will be difficulty in exchange of oxygen from carbon dioxide, alveoli, where we call it alveoli. This virus affects the alveoli, and thus the patient carbon dioxide levels will be increased, oxygen levels will be decreased, causing decrease in saturation levels, decreased in breathing tendency. So this can be monitored by using a pulse oximeter, where we now everyone is aware of pulse. What is pulse oximeter? Just putting the middle finger or any finger on the pulse oximeter and seeing the reading. It should be around 94 and above. If patient having fever, cough, cold, throat pain, weakness, nausea, headache, along with that saturation is dropping down less than 94, then that patient should be considered as a serious case and should be admitted. So these are the things where we have to be more careful in coronavirus. It is a normal virus like any other virus, but it has more complicated issues. So many of the people in all over the world are attacked by coronavirus, but most of them are recovering, because this is a normal virus like any flu virus. But it in some cases where the immunity is less or patients' ability to withhold the disease is less, those patients are really affected. And most of the old people also affected, as they have old people autoimmune complications, any cancer patients, AIDS patients, HIV patients, any kind of diabetic patients. These patients are mostly affected with this kind of virus. Why? Because their immunity levels are very low, and body will not be able to fight with the virus, and the virus will attack whole of the other organs and decrease the function of the organs. So these are the things where I just want to highlight regarding the clinical symptoms, and what to be taken proper care is like isolation is the first priority. Patient has to be isolated, monitored his saturation levels, monitored his fever levels. Antibiotics should be given. Antibiotics should be given to avoid any secondary infection. To be honest, antibiotics have no role, but to avoid any secondary kind of infections, we do give antibiotics also, and some immunoboosters like vitamin C, vitamin D, and these kind of immunity increasing treatment should be proposed. So this kind of treatment and this kind of things where we should be more careful, so that patient will not be deteriorating. And day 1 of the clinical symptom to day 14 of the clinical symptoms, every day is to be counted, to be noticed, and every day is is observed. And most of the cases after 10 days or 12 days, complications, if there are no complications, patient will be out of danger. We can say that patient is symptomless. So some patients, they don't even know that they have been attacked coronavirus. They just comes like a flu and goes away. Some patients, it will affect mildly, some patients moderately, and some patients severely. As I told you, there are different kinds of variants in the coronavirus also. So day by day, we are seeing new variants in the world. The new coronavirus is taking its own shapes, size and structure, and modifying itself and causing more visible, more worsen effects on the lungs. So these different kinds of effects which are seen in coronavirus are nothing but the complications, which it attacks mainly in the lungs, then it goes to the kidneys, the liver, and sometimes brain. And we have seen some patients with patients having neurological symptoms also with coronavirus. They go into paraplegia, hemiplegia. That means that it's like paralysis, what we call paralysis. So coronavirus also affects the brain in some patients. So these are the complications associated. And vaccinations which are available in all over the world are helping humankind so much that it has almost as it has been after post vaccination, patient death rate has completely come down. Prognosis towards healthier life is increased. So all the patients what we suggest, doctors we suggest is they have to be vaccinated and be safe. Vaccines have their own side effects, but very rarely we see side effects in any human mankind. Very rarely. So out of 100 people vaccinated, 100 are fine. Only 1 or 2, 99 will be fine. 1 or 2 will have minimal complications like body pains, headache, nausea. That's all. If those complications can be managed only with antibiotics, and nothing can be given like any other drugs like antibiotics or any anti-inflammatory drugs or NSAIDs, what we call, should not be taken. Patients post vaccination having any kind of symptoms like headache, myalgia, vomitings, or any kind of complications, they should be visiting their physician or pulmonologist. But other than that, they should not be taking their own decisions, and they should not be taking any NSAIDs, anti-inflammatory drugs. They have to go to their physician or pulmonologist and then get their treatment done. So these are the complications, and then these are the things which should be highlighted regarding coronavirus. So vaccines had really played a big role. Thanks to our scientists, thanks to our health association people all over the world, that they have created a vaccine which really is helping mankind. So this vaccination drive is going on still. So I request all the human mankind to take the vaccination and stay healthy. Thank you.